Thank you for the opportunity to speak at this year's Suicide Prevention Forum to mark World Suicide Prevention Day. And can I begin by expressing special thanks to Merryn Statham from Suicide Prevention Information New Zealand for all the effort that she has put into organising and promoting today's forum. I remain extremely concerned that the number of people who die by suicide each year is still higher than the highly publicised national road toll. A fact I think that horrifies many New Zealanders when they learn it. Suicide prevention is and will remain an important area of the government's work. So what are we actually doing in this space at the moment? While there is an incredible amount of work still to do, it is good to see that the New Zealand Suicide Prevention Action Plan continues to be implemented and supported, because that plan provides the government with a clear set of goals to help reduce suicide. And today I want to focus on progress on three goals of the plan: greater access for everyone to primary mental health services, further improvements to the National Depression Initiative, and implementing clinical guidelines in district health boards to improve the management of people who make a suicide attempt. As we all know, mental health problems are a leading cause of suicide in New Zealand. Between 70 and 90% of people who make serious suicide attempts or who die by suicide have a recognised mental health problem at the time. More than 80% are untreated for that problem when they die. These trends have been reported in a number of New Zealand studies. The figures show that if we want to reduce suicide, we need to address mental health problems first. Some of the research indicates that if major depression alone could be eliminated from the New Zealand population, rates of suicide and suicide attempts could be cut by more than half. The government has improved the management of mental health problems by providing $22.2 million for free primary mental health services across New Zealand. These services recognise, treat and manage mental health problems such as depression that are commonly associated with suicide and suicide attempts. The services available include free counselling sessions and free extended GP consultations. And thankfully, we already have strong evidence that these services are helping New Zealanders fight depression. They are making a difference. The University of Otago conducted an evaluation of the services in 2009 and found that 80% of the patients were showing positive improvement. They also were expressing satisfaction with the care being provided. These positive results bode well for the future of mental health services in primary care. The second area that I want to mention is the National Depression Initiative. The NDI is a key part of the government's suicide prevention plan, and it's probably the most famous part of it, thanks to John Kirwan. He has been a great asset to the NDI, and I cannot emphasise how glad we are to have his support and involvement. Because what he's enabled us to do is target some of the difficult to reach groups, such as middle-aged and older men. And I understand that some GPs are noting now that their older male patients are coming to see them about their depression, but saying they've got a touch of the JKs. I think that's great, and I think we've got to do much more to encourage people who sense they may have a touch of the JKs to come forward and seek help. Like the primary mental health services I spoke of a moment ago, the NDI focuses on helping New Zealanders cope with their depression. For some years now, it's provided a free helpline, online and text-based support services, and education materials to support people dealing with depression. And I understand that there were over 100 emergency interventions by NDI support staff in 2009, which of itself is a clear indication of the initiative's value. And in June, the government launched The Journal, a further improvement to the NDI. The Journal is an online self-management tool for depression, co-presented by John Kirwan. It is also supported by a team of counsellors based at Lifeline, who provide personalised help for Journal users via text, email or phone. And last week I was in Christchurch, some days before the tragedy that befell that city, meeting with Lifeline to talk firsthand about that service and the counsellors and their experiences. And their most encouraging thing has been that pre-testing is showing that it's been effective. That only a quarter of the 55 people who took part in the study who have depression decided not to complete the program. That's still a quarter to worry about, but the good news is that preliminary trial is showing 3/4 effectiveness. The self-help approach that it offers is something that the users enjoyed, and they appreciated the program's anonymity and the convenience of being able to visit the journal at their leisure. A second evaluation will begin in November so we can find out the long-term effectiveness of the journal as a device. But I'm hoping that this evaluation will provide further evidence that the journal is helping New Zealanders manage their depression and thus reducing their risk of suicide. Improving the mental health services available in primary care and enhancing self-management for people with depression are both important to reducing suicide. But we must also improve the care of those who actually make an attempt and who end up in hospital. These people are at a high risk of making another suicide attempt, which makes them a particular concern. And I sometimes think that too often, when they are discharged from hospital, there is an assumption that they are on the road to a full recovery. Unfortunately, tragedy returns a little later on. So that is why the government's suicide prevention plan includes implementing a new clinical guideline within district health boards to improve the management of people who make a suicide attempt. That guideline is designed to improve crisis care in 3 areas: in emergency departments, in Maori health services and in mental health services. And it aims to reduce the risk of people making those further suicide attempts that I referred to a moment ago once they are discharged from hospital. The project is in its final year, and the clinical guideline has now been implemented in 14 DHBs across the country. Outcomes from it so far include increased collaboration between emergency departments, mental health and Maori mental health services, decreased waiting times, an increase in the number of initial risk assessments from 47% to 72%, an increase in the provision of discharge plans to patients from 3% to 35%. They are good steps we need to build on. The Guidelines Group is working with DHBs to develop a community of practice to ensure that the gains already being made by the implementation are maintained and expanded. What I think the progress to date shows is that the work being done by New Zealanders on suicide prevention has not been in vain. It is saving lives, and that's a fact that we should take some strength from. It should energise our efforts for the future, and it should give encouragement to families and colleagues that we can arrest this serious issue that is destroying so many of us.